Okay, so I welcome you all today to a live sessions of OET. Now, today we are going to learn about punctuations in OET. What is the role of punctuations in OET? Because if you master this technique, finding answers in reading part B, part C, or part A will be super easy. This is something which is going to make like it will make a cake, like make this OET reading a cakewalk for you. So that is something our aim is today. So when we start this, you can put in your comments in the group. You can put the comments in the chat box on YouTube chats so that I get to know that you're following it, you're able to understand the answers. So my aim is that you should understand this technique. Why? Because if you understand this technique, many a times I feel like candidates coming and telling me like I feel reading is pretty difficult. I don't feel like I'll be able to make it. Or I even get these kind of feedback that when I do reading questions with you, I find answers. But when I go back and do it at home, it's very difficult for me to find answers. So I want you to understand today all about the techniques. Okay. Now, I believe the screen is visible and it's there on your screen as well. Now, the most important when you do a reading part is 3 second grammar prediction. Now, what is this 3 second grammar prediction? This is where you understand what, like, you predict what type of word would be an answer. It can be a noun, it can be a verb, it can be an adjective, it can be a verb with ing. So it all depends on what kind of word is it. Like as you can see it over here, the word before the blank space, that is the, a, or an. If you ever see these kind of articles, the answer type would always be a noun. If you see a possessive noun like persons or patients, that's called as possessive noun. So obviously the answer type is going to be a noun. Words like quickly, slowly, obviously the answer is going to be a verb, or extremely, highly, or very, answer is going to be an adjective. Or if it is, are, was, where, it's adjective or verb plus ing or a noun, depending on the word type. Now today we will see, based on the word type, how does this work. So I'll start with few questions of part A. I'm trying to teach you the techniques. Now, the question says, as you can see it on the screen, drugs that affect the dash can be used to reduce the level of cortisol in the body. Now, first of all, the first technique, when you get your part A question paper in your examination, what you should do is try to understand what are the four texts: text A, text B, text C, and text D. You need to understand what are the four texts so that when you read the question, it won't be that difficult for you to understand which paragraph will contain my information that I'm looking for. Like this particular given paragraph is all about physiological effects of stress. So if my question is about stress and physiological effects, I'll come directly to this paragraph. Now the question says drugs that affect the. So here the article clearly says the word which is before the blank space is the, obviously your answer is going to be a noun. Okay, so article is the. Now, always underline keywords in your questions. Keywords are nothing but noun and verb of your question. So what are the nouns over here? Nouns are drugs, cortisol, and level. And what are the verbs? Verb means action. Verbs are affect, used, or reduce. These are the three verbs. So many a times you may listen this word or this statement in many of the YouTube videos, or maybe many of teachers have used this. Underline the keywords. Now, when I generally ask someone, according to you, what is the keyword? People would say that important words. Now, you need to understand how do you define those important words? How do you understand which word is considered to be important? So, the simple answer is underline the noun and verb of the question. Always the noun and verb will be your keyword. So, you need to look for those words. Now, over here, the nouns are what? Drugs, cortisol, and level. So, you'll have to first of all find where is cortisol. Is there a synonym for drug? The synonym for drugs are usually medications and level. Now, once you underline these keywords, then you should read those lines where these keywords are present. So you don't waste your time in reading everything. It's pretty simple. Underline the keywords and be ready. You underline the keywords and read only those lines, you get your answer. Now you can see there are two lines. where you find cortisol. There are two lines where you find medication. Now, question is, drugs that affect the dash can be used to reduce the level of cortisol in the body. So, drugs are affecting something. You will have to understand affecting what. Drugs that puts effect on something. So obviously the answer is going to be a noun. So obviously that is going to be name of an organ, name of a particular system in the body. It can be a name, it will be a name. So you'll have to look for that. Now I'll give you 20 seconds. You can just go through it. People can put in your answers in the chat box. You can write it down. You can give a guess. So this will help you to learn. This is nothing for me, but this is completely purely for you. This will help you to learn. So I'm actually checking the chat box. You can put in the live chat. What do you feel the answers are? So I want people to participate in this. Okay. Perfect. You can put in the chat box. I can read your live chats. Yes, everyone. What do you feel? Yeah, good. Okay. I'll wait for another 30 seconds and then I'll begin. You can put it in the chat box. You can put in the comment. You can click on the comments and you can write. Okay. Try with it. Give a try. Yes. Okay. I can see many people have put in. Yes. Wonderful. Okay. So the answer is pretty clear. If you read this carefully, what do you understand? The first line says where you found the first keyword. How high cortisol, is also associated with type 2 diabetes. Now, my question is about affecting. My verb is affect the dash. So I cannot say the type because that's name of a disease condition. So you never say the type 2 diabetic mellitus. Impaired brain function and infections. It is produced in the adrenal gland, pituitary gland, and hypothalamus. Medication can be taken to reduce the production of cortisol. Such medication affects, now you can clearly see it matches my keyword. Such medication affects the adrenaline gland and include metro. So my answer over here is drugs that affect the adrenaline gland can be used to reduce the level of cortisol in the body. Very good, everyone, those who have commented. Keep it up. Next one, let's go for another one. The paragraph is same. Stress hormones activate the dash. Okay, now the blank space is the, so obviously my answer is going to be a noun, causing IBS symptoms to become more prevalent. Prevalent means more evident or common. So stress hormones does something over here. They activate something. You need to understand what is that one thing they activate, which causes these symptoms to be more prevalent. Now, article is the over here. So obviously my answer is going to be a noun. So what are the nouns over here? Nouns are stress hormones, IBS symptom. And what are the verbs? Verbs are simple. It's verb. Verbs are actions. It activate, causing, and become. These are my verbs. So I need to read carefully and understand where all I can find these keywords. So I can see over here, IBS is over here. I can see stress hormones over here. So I'll have to read these lines carefully to understand what's my answer. Stress hormone is activating something, and the byproduct of that activation is these symptoms. So read carefully and tell me what can be the right answer. I'm checking your chats. You can put in your answer. Yes, by stress hormone, and I can see the verb over here causes and activated. So read these two lines, you get your answer. IBS symptoms can be made worse by stress. Stress affects the immune system, which directly affect the gastrointestinal tract. This is because once activated by stress hormones, the immune system causes inflammation through the GI tract, causing what? Cramping, change in stool consistency. What are these? These are symptoms. So, what is that one thing which is causing these symptoms? Something is getting activated. Stress hormones are activating something. So, what is it? You can put your answers in the chat box. You can try. Give a try. Yes. Stress hormones activate the dash. What is it? Put it in your chat box. Okay. Some are putting it in the WhatsApp chats. Yes, even that is fine. But put it over here. It'll be very easy for me to access. Activate what? Right. Mm-hmm. I can see many people dying it. Okay, very good. Wonderful. Wonderful. Yes, that's correct. The answer is immune system. The immune system causes IBS symptoms to become more prevalent because it clearly says. So pay attention whenever you're doing your part A. Underline your keywords. That's noun and verb. And this grammar prediction trick can definitely help you. I'll also teach you something called as model verbs. If you understand model verbs well, predicting your answers and understanding what could be my answer, whether it's a possibility, it's going to be a confirmatory statement, you'll be able to predict that. You'll be able to gaze what type of answer I'm looking at. So that will make your job easy. So next time when you do part A, try to do it this way. Let's do one more question. Now, what you can see over here, it clearly says biting nails, being restless, drinking or smoking, as well as getting angry at people are few examples. So, first line is all about examples of how stress can impact a person's dash. So, person's apostrophe S. So, when you see apostrophe S, obviously that's a possessive noun. Obviously, my answer is going to be a noun. So here it says persons, which indicates the answer is going to be a possessive noun. Nouns over here in the question is what? People and person. Because biting nails is an action, being restless is an action, drinking is an action, smoking is an action. So all these symptoms are mentioned over here. Now, biting nails may sometimes may not have much of synonyms. So finding these words would be really easy in the paragraph. Look for these symptoms. The place where you find all these symptoms, that is the same place where you will find all the answers as well. So read it carefully and tell me what can be the answer. I'll give you just 1 minute. Here we go. Quick, quick. Okay, perfect. So you can put in your answers, everyone. Perfect. Yes. Yes, I can see the answers already coming in. Perfect. Try for it. Others also, you can put in your message in the group. So it's very easy to find out where is actually biting nails, being restless, these words, where exactly is it? We are very clear. Now we know where the word is. So finding answers won't be that very good. Yes. Oh, wonderful. Priyanka, I can see your answers. Other people have messaged the answers. It's pretty simple. Biting nails, being restless, drinking or smoking. You will have to find that where exactly is it. Can you see this? We can clearly see where these words are. Yes, it is the answer is behavior, but we can clearly see where these words are. Stress can affect a person's behavior, causing them to bite their nails. It matching my keyword. Experiencing restless, the synonymous being restless. Drink or smoke. What is drink or smoke? That is drinking and smoking. And snap at people. What is snapping at people? Snap at people means angry at people. So this is how they use synonyms. If you understand that, and finding answers won't be difficult at all. So if you read that, it should be noted. However, the people manage stress differently. Now, my keyword was what? Stress can impact a person's. Impact, the other word for impact is affect. So the answer over here is stress can affect a person's behavior. So the correct answer over here is behavior. Very good. Wonderful. You guys are doing so good. Let's go for another one. Apart from reduced brain functioning and infections, which condition is associated with high cortisol? So I'll give you an exercise right now. How many of you can tell me which all are the noun over here and what are the verbs? Noun and verb. Can you quickly put it in the chat box? Won't take much time. Quick. Yes. What are the nouns and what are the verbs? Nouns and verbs. Who can tell me? Quick. You can put in the chat box. Good. Yes. Mm-hmm. Correct. Anyone else? What can be the noun and what can be the verb? Simply hit on the chat message because when we have a good connect, it will be easy for me to teach you so that I understand you are able to follow what I'm trying to teach you. So, apart from reduced brain functioning and infections, which condition is associated with high cortisol? So, I just need noun and verb. So, the nouns over here, what are the nouns? Which one can be the nouns? Perfect. Now, you can see, as I can see even in the chat boxes, good. Nouns are cortisol, brain and infections. Cortisol is name of a hormone, brain is name of an organ, and infections, obviously, it's a noun. What are the verbs? Verbs are usually ing forms, associated and functioning. Now look for these words. Where all you can find the word cortisol, brain, and infection, the answers are nearby to that. Come on, try. First, I'll give you some time. Yes, very good, Swapnil. Good. Brain infection and cortisol. Wonderful. Wonderful. Chalo, go ahead. Even others can try. You need to keep trying. You should be able to identify noun and verb. That's more important. So I'll give you exactly 30 seconds. Go through it and find the answer. Yes. Wonderful. You can put in the chat box. You can write yes. I can see answers coming in. Good. Mm-hmm. Very good. Yes, you can type in the answers. No problem. Wonderful. I started getting the answers. Good. Yes, that's correct. Now, what we can see? What are my keywords? My keywords are brain infections, functioning, and associated. I can see brain function over here. Okay, brain function and infection. Both the things are over here. I can see high cortisol over here, which is matching my keywords. It clearly says high cortisol is also associated with type 2 diabetes, impaired brain function, and infections. My question was apart from reduced brain function and infection. So already two conditions were mentioned. I just had to find the third condition. So wherever I find impaired brain function and infection, the very next to that you'll find the third condition. The answer is type 2 diabetes. Good. Now, let's go for some more questions. Now, this is a little complex. I won't say much. This is the last question of part A, then we'll move on to part B. Now, question is a little complex, but understand. In addition to the arms and legs, which area of the body is most likely to be affected by chronic plaque psoriasis? So, what's my keyword over here? My keyword is pretty simple. The name of the condition, that is chronic plaque psoriasis, and arms and legs. Sometimes they play badly with synonyms. You need to be very careful about this. Now, read this. Wherever you are able to locate chronic plaque psoriasis, the answer is nearby to that. You don't have to waste your time in reading the entire paragraph. Part A is all about crucial timing. It's all about how quick you can locate. So I always say that the technique should be scan, spot, and skim. What is scan, spot, and skim? First, to identify the word which you're looking for. So scan and look for that word. Spot that word, then read that. Wherever you spot it, read that entire line, you'll get your answer. Same thing applies over here. I'll give you 30 seconds. You can put in the answers if you already got it. In addition to arms and legs, same like the previous question. They already mentioned arms and legs. We just need to find the third part of the body or area of the body. Simple. Try it. Yes, good. Priyanka, you're too quick. Good. Wonderful. Yes. Right. 10 seconds. Wonderful. So first is you'll have to underline the noun and verb. So as I can see, the nouns are arms and legs, chronic plaque psoriasis. Verb is affected. Go and locate where can you find chronic plaque psoriasis. You find here. Read that line carefully. You will find the answer. My question is in addition to arms and legs. Can you read this? These may affect any body side, often symmetrically, especially the scalp and extensor surfaces of limbs. What do you mean by limb? Limb can be upper limb and lower limb. Limbs are arms and legs, upper limb and lower limb. So upper limb and lower limb was over here, that is extensor surfaces of limbs, which is the third part, that is scalp. So the answer is scalp. Perfect. Good. Well done, guys. Now let's go for part B and part C. Let's understand quick. There is something called as model verbs. So I'm just listing these it down over here. You can copy this into your book. You can take a screenshot. These are certain levels of model verbs. Level one is strong obligation, something which has to be done by someone. It is strong obligation, there is no choice. Words like must, have to, need to, must not, cannot, will. If you see these words in your question, always understand your answer is also going to be a strong obligation. Like, I must do this. If I say I must do this, there is no option for me. I say I may do this. I have an option. I may or I may not. I should do this. That is required, but it depends on me. So, level one is all about strong obligation. Level two is all about advices or like you should do it. You're out to do this. You should not commence this. You should not do this. That's all about that. That comes when you're providing an advice or recommendation. Possibilities may, might, could, can, would, shall. It's all possibilities. I'm not sure. If your question has got these possibility words, obviously your option is also going to be a possibility. You need to understand this clearly. Now let's go for some question. And the last one is contradiction. This is very important. Level 4. If you ever find the word however or although in your part B or part C questions, or not questions, I would say, in the paragraph, be careful. Usually the answers are nearby to these words. So these words are used just to show a contradiction. So initially the paragraph may be all about positive. After this word, they'll speak about negative. Something contradicting to each other. When they want to give contradicting informations, they'll use modal verbs like however or although. So you need to understand this carefully. Now, this is the question, this is the paragraph. The question says the email about smoking cessation tells hospital staff that they, okay, now you can see these model verbs in the option as well. Must familiarize, which means there is no option, you'll have to do it. Will receive more support, not sure. Should take time to take talk patients about the issue, which is a recommendation because there is a word should. Always pay attention to the first word carefully. Okay, should. And pay attention to contradicting words. Read this paragraph carefully and tell me what can be the answer. I'll give you 2 minutes. Your keyword is smoking cessation. The timer is on. Read carefully. Wonderful. You can type in your answers, no problem. You can say anything what you feel. If it is wrong, I'll discuss it with you, no problem. We just have 2 more questions to do, so it won't take much time. Write it down. Just comment. Wonderful. Time is about to be up. Please write your answers. What do you feel? And write down your answers. Just click on the chat box on YouTube. You'll be able to find where you can type the answers. Because I can see around 24 people have joined. So ensure that you type your answers. A, B, C, or D. What can be the answer? The email about smoking cessation tells hospital staff. So what's your keyword? Smoking cessation. Where all you can find smoking cessation? I can find it in the third line. I can find it in the second last line. I can find it in the last line. And bonus, in the last line, I can see a contradicting word, however. Now, I will read only three lines where I find smoking cessation. The first is I can see in the third line, and it begins from my first line. That is, smokers in hospital are often motivated to quit due to concerns about our health. They are much motivated, and most are receptive. Receptive means they are positive. They respond to what the advices that you give. Advice from hospital staff. So, first point I know in the hospital, patients are more motivated to quit and they listen to the hospital staff. My second line, that is the last, second last line, that begins from despite. No, sorry, that begins from interventions. Interventions are delivered by busy clinicians in addition to the existing patient care responsibilities, and many feel that discussing smoking cessations are not part of their role. So busy clinicians, what they do, they just give interventions and they feel that is not part of my role. However, now something contradicting is coming. However, smoking cessation support is the responsibility of all the clinical staff. They're not giving an obligation, they're giving a recommendation. That, yes, wonderful people. I can see a lot of people have written C. Good. Why? Because that is the recommendation. So, as I told you, must is an obligation. Will is something possibility. Should is a recommendation. And your paragraph talks about recommendation. So the correct answer over here is C. Should take time to talk to patients about the issue. Wonderful. Good. Keep it up. Let's go for the second last question. The main point of the section of the guideline is to, you just have to understand the main gist of the given paragraph. The main gist. Nothing else is required. Read it carefully. Understand the main gist of the paragraph. That's it. Simple. Your time starts now. Read it. I'm sure you're going to do it. Sorry, I'll display it again. Read the first para carefully, read the second para carefully, understand what does it say, and then move ahead. Because that will give you a clear idea what exactly the paragraph is about. You have 2 minutes. The main point of the section of the guideline is exactly 2 minutes. You can put in your answers if you get it. You should understand the main point. That's it. There's a second last question, last 58 seconds, and we're done with it. Understand the overall gist. What are you trying to explain here? Just the overall gist. That's it is required, nothing more than that. The first para clearly says clear oral fluid should be actively encouraged up to 2 hours prior to the surgery. This should be considered mandatory in the very old and very young, those in hot environments and those who are pyrexial. So it is just clearly telling me clear oral fluid should be given, but only up to 2 hours prior to surgery. And I can give it to young, considered mandatory in very old or very young. These in hot environments and those who are pyrexial. Pyrexial means fever. So my first para tells about to which kind of patients I can give and when I should give. Now, if I look at my option, it says explain why patients should consume fluids before surgery. Also, it says confirm which patients are allowed to have fluids. My first para doesn't say which patients are allowed to have. It clearly tells me very old and very young I should give. So it doesn't confirm which patients are allowed. Neither it confirms why patients should consume fluid before surgery. Neither it says anything about the quantity. What I'll do, I'll read the second paragraph. Now, what does my second paragraph tells me? What is the main idea? Okay, before I tell you the answer, I want people to tell me what's the answer. Let me see how many of you have commented and what's your answer. Perfect. Okay, wonderful. See, explain why patient should consume fluid before surgery. Where does it say? Some people have selected A. Where does it say? My second para clearly says after the 2 hour deadline for the free fluids and right up to the time of surgery, a nurse may still give the patient 30 ml of water. This may be either for patient comfort or allow the swallowing of any prescribed medication that were able to be taken before 2 hour deadline. The maximum allowed is 30 ml of fluid in any given hour. So what am I saying? Some amount of water can be given, maximum is 30 ml. That can be for like swallowing any prescribed medicine. Some amount can be given. Okay, should the patient request it unprompted, like he's troubling you a lot, he wants a little bit of water, 2 hour deadline, maximum allowed is 30 ml. That too for a particular purpose. The concession must not be taken as allowing the patient free access to water, as exceeding 30 ml per hour of water so close to surgery could delay the operation. So, what is the main point? It is specifying the amount. So, your understanding should be this way, that what is it specifying? The specification of the amount of water. So the correct answer over here is C, specify the content of fluids, because it clearly talks about all the model works may. This may either, the nurse may still give. So the correct answer over here is C. Got it, everyone? So I'll go for the last question now, and maximum of you have answered correct. Last question. This is from part C. How does Zishan Sayed feel about using ML? ML is machine learning in healthcare. So your keyword is pretty evident over here. Okay. I always tell you noun and verb. Zeshan Sayed is a noun because that's a name. What's his feeling? What does he feel? Or what does he say about machine learning in healthcare? Just locate the word Zishan Sayed, you'll get the answer. Wherever you find Zishan Sayed, the answer is nearby. Read it carefully and comment the answer. That's the last question for today. Next week, Saturday, we'll have the similar kind of lesson, maybe for writing, maybe for other module, but I'll keep you teaching new methods and new learning which you may not have in your regular lessons. I'll keep on adding new things so that you clear your OET in your one attempt. You don't need any other attempts. One attempt, give your best shot. Whenever you are planning to write your exam, there should be only one attempt and the best shot. So ensure, keep practicing, keep learning. Perfect. You can put in your answers. If you found Zishan Sayed, where exactly is it? You can put your answers. Yes. Good. Put it in the group. Put it in the chat box. Okay. Good. Okay. Maximum of people got the right answer. See, now where do I see Zeshan Sayed over here? Where do I see? I see it over here. Now, what does the line say? Now, wherever you found the word, you'll have to see where is that line beginning from. The lines are beginning from after years of experimentation. It's predictive powers. Who's predicting powers? Machine learning. This entire paragraph is about machine learning. Okay. Now, some said C. C is not the right answer. Read carefully. The predictive powers are well established. Well established means widely known. And it is poised, which means positioned to move into broad real world application. Z. Zishad Sayed. So, what is happening over here? Zishad Sayed is saying that it is, you cannot stop it. It is something which is unstoppable right now. It's well established. It has got good predictive powers, and it is already positioned to move into real world application. So he's very confident about it. So my option over here is confident that it has already proved its potential worth. Now some says A. If you say A, relieved that it has finally been accepted for use, there is nowhere it shows that he was stressed. And currently he's like, relief means what? I'm happy. Thank God it has happened. No, it doesn't say that. B option says unsure. No, he's not sure. He says it is well established. Concerned that it will cause more problem. Does Zeshan Sayed say that? No, he's not concerned. He's confident. Look at the first word of all the options: relieved, unsure, confident, or concerned. My question is, how does he feel? These are the four feelings. It's clearly mentioned: relieved, unsure, confident, or concerned. So you just have to locate the keyword, find where exactly it is, and just understand the feeling. What kind of feeling does he have? You get your correct answer. That's C. Perfect. I believe you have learned something from this lesson. So if you have learned something, ensure put your comments on the chat box. Let me know, how did you feel? Was it encouraging for you? Did you learn something? What improvements? Even if you want to put some improvements that this can be done this way, I need a few more lessons on writing, listening, whatever your comments are, please put in so that I know what type of lesson should I come next time so that you learn something from it. Okay, then, guys, that's all for today. Thank you so much for joining in. Have a beautiful